Well, it's not cancer that's the leading cause of death for both men and women. Dr. Michael Liston, Chief Medical Officer at St. Mary's Medical Center, explains what you need to know once you know your risk factors.
Coronary artery disease is the #1 killer in the United States. We've had this pandemic going on, but still in the background, and certainly it's going to be there in the past, the present, and the future, is coronary artery disease. The way this typically presents is with an acute heart attack, or even worse, sudden cardiac death or cardiac arrest. Obviously, if we could pinpoint who's at risk for these problems, it would behoove us to treat them ahead of time. So as we always say, an ounce of prevention is worth a pound of cure. Hypertension, diabetes, hyperlipidemia, smoking history, and family history of coronary artery disease. Those are the sort of the big five. So oftentimes people will go through these risk factors and find that they may not fit all of these risk factors or only a few of them, yet still have symptoms of chest pain, shortness of breath, or other concerning symptoms. In that case, I advise them to certainly let their physicians know so that they can sit face to face with their physician, talk about these symptoms, and decide with their physician's help whether these warrant further evaluation. One of the tests we're using fairly frequently nowadays is a simple test called a coronary calcium score. You've been identified as having coronary artery disease perhaps by a coronary calcium score or findings on a chest x-ray or CT scan. You may be having no symptoms at all, and you may feel like, well, things are stable, I'm okay with that. But there are certainly other risk factor modifying things we can do. Lowering cholesterol, specifically LDL cholesterol, goes a long way in preventing heart attacks and strokes and other vascular complications. If our blood pressure is out of control, certainly taking care of that is important. Increasing our activity can be important. Oftentimes some dietary changes may be necessary. If we have diabetes, it's important that we get a handle on our blood sugars. In my mind, there's a large portion of the population out there with risk factors that are running around living their daily lives as they should, who are unaware of the presence of coronary artery disease in themselves. And that's just sort of a ticking time bomb for some of them. Some populations don't have typical symptoms. Women and diabetics in particular may have funny symptoms of a queasiness or a nausea or exertional fatigue or just a general discomfort or not feeling well. And although those symptoms are very non-specific, they could be symptoms of underlying heart issues. So as you can see, we have a long way to go to get everybody educated. We have a large portion of our population who we still need to reach out to and evaluate in order to get a better handle on the overall effect of coronary disease on our population.
St. Mary's Heart Center provides state-of-the-art cardiovascular care. Services include prevention, detection, and disease management. For additional information, call 816-655-5250 or go online to stmaryskc.com.